Good evening, everyone. My name is Stephanie Taylor, and I want to thank you all for joining us for our very first session of our Northeast Region Ovarian Cancer Wellness Symposium. And it's an honor to kick off this lovely program with a conversation about a topic that many of you have asked several questions about. So we are going to kick off our session about palliative care. Is it right for me? And I would like to take a moment to introduce to you Charlotte Stone. Charlotte Stone is a nurse practitioner on the interdisciplinary palliative care team at Lenox Hill Hospital and clinician at Northwell Health Supportive Oncology Clinic. She has advanced practice training with the palliative care and oncology teams at Massachusetts General and Dana-Farber Cancer Institute, as well as Memorial Sloan Kettering Cancer Center here in New York. She has dedicated her career to helping patients and their families cope with the stresses of living with a life, limiting illnesses at all stages of their disease experience. So we want to welcome and thank you very much for being here with us tonight. And I am going to ask everybody now to turn their attention over to Charlotte. And so Charlotte, please welcome.
Thank you so much, Stephanie. Just confirming, can everybody hear me? We're good? Everyone can hear me? Awesome. So again, thank you so much for having me. My goal tonight is to be able to kind of demystify a topic that has a lot of taboo around it, not just among patients and families, but also just within the healthcare system itself. So I want to make this an interactive experience. So I do want to give 15 minutes or so at the end for any questions or reflections or comments, and hope that this can be as beneficial as it can be for you, for people that are in your family, for people that are in your sphere. So this is for anyone and everyone, and I hope that you'll take away some good points from it. So we have about 45 minutes to go over these topics here. The big thing, I'm going to start off by explaining what palliative care is not. But the bulk of the conversation will be about what we do and how we can help you, how we can help your family. And then kind of just simple things like, how are you going to get it? Where do I get it? How much does it cost? Does my insurance cover it? And then again, like I said, just allowing you some time at the end of the discussion for you to kind of reflect on or answer any questions that I can help you with, and hopefully provide some resources and links so that after this conversation that you'll be able to have a place to go to get more information. So I'm going to start off this right away and address the elephant in the room, that palliative care is not the same as hospice. It is not the same as end-of-life care. It has nothing to do with death and dying. It doesn't have anything tied to taking away hope, to take away people's wishes. So it's important for me that we kind of make clear this from the start, that this discussion is not about hospice. And I'll kind of explain just briefly the difference between the two so that you can have a better understanding and feel a little bit more relaxed as we get into kind of the meat and more important part of the presentation, okay? Because, a lot of times when I meet patients and families, oftentimes the first kind of assumption is that I am here to start a morphine drip and we're not doing any more cancer treatment, and that is that, okay? Everyone's DNR, DNI. That's not what palliative care is. If there's anything that I want you to take away from this presentation, it is this slide. That is the most important thing. The rest of the stuff, we will give you resources at the end of the discussion that you can use. But just to clear the air, this is not about end of life. This is not about hospice, okay? So the way I kind of explain it is that hospice and palliative care are in the same family. Palliative care, I describe as the umbrella, okay? So it's kind of like the umbrella overarching field. Hospice is just like a little subsection of that, okay? It's just a little part of that. They're two separate spheres. They are, however, united, and this kind of is where the misconception comes from, is that they're the same foundational philosophy, okay? So the goals of hospice and the goals of palliative care are two words, simple: reduce suffering. That is what palliative care is. We're here to help you reduce your suffering, and we'll talk more about what suffering is. Palliative care is an approach for anyone who has a serious illness, okay? So people who have cancer, people who have dementia, people who have heart failure, people who have COPD, people who have Parkinson's disease. There's no word of dying in this definition. It's just for people who have a serious illness. They can be receiving treatment for their serious illness. In this case, you know, for the people that are on this call, it's for people who are receiving treatment for their cancer, okay? You can be receiving that treatment, or maybe you're not. But the point of palliative care is that it's for anyone who is suffering from a serious illness, and you may or may not be receiving treatment for that illness, okay? Hospice is a little sliver within that umbrella, okay? The way I kind of explain it to people, it's a type of palliative care, and it is for people who are at the end of their lives, who usually have, you know, months to live, months to a year, and they are no longer wishing to receive any treatment for their cancer, for their heart failure, for their Parkinson's disease. Hospice is for people who are focused on spending time at home and enjoying as much of a quality life that they can have with the time that they have left, okay? So again, want to just make a point right now that hospice and palliative care are not the same thing, okay? They're not the same thing. Palliative care is a completely different thing from hospice, all right? So I just want that to be kind of established before we kind of get into the more important things, which is what is palliative care. I hope that moving forward, we can kind of focus on demystifying, you know, myths, talking about what it is, and helping you take the best care of yourself or those people that are suffering in your universe. Okay, so we know what it isn't. All right, so what is palliative care? All right, so the simplest way to define it is an interdisciplinary approach to improving your quality of life, period. That's it. It is for people living with a serious illness. In this case, it would be cancer. And the focus is to relieve suffering. And we'll talk about what suffering is, what that looks like. It's not just physical, as you all know. It is existential, it's spiritual. Suffering and pain is not just physical. So palliative care is really here to help you alleviate suffering as you progress through your disease experience, okay? Most of my time is spent here in the hospital. So it's important for you to know that I'm seeing patients when they're truly at their worst. They're here in the hospital, they're needing IV medications for pain, they're needing IV medications for nausea. So I really kind of see them in their worst. We'll talk a little bit more about later where you can get palliative care. It's important to kind of differentiate that there's inpatient and then there's outpatient. Whether you're in or you're outpatient, I really kind of try to explain to families that we're kind of here to kind of walk with you. Okay, so we walk alongside you, we walk alongside your loved one, and we kind of help you keep your hope. We help you find why it is that you live, what gives you meaning, what gives you purpose. And it's important for you to have somebody like that in your team, because as you all know, cancer is a roller coaster. And there are low, low, low lows, okay? And once you get out of that low, you don't really know when the next time you're gonna be on the down again, okay? So it's important to kind of think about palliative care as a team that's gonna help you navigate all of this, help you find light, help you find hope, help you find a why to live, especially in your darkest. Which in my immediate day-to-day is here in the hospital, and most people who are here in the hospital are feeling their worst, physically, because they're physically here in the hospital needing to be admitted. This is a really excellent model that actually came out of Canada. And it's one that I've started to use a lot because of the visual aspect of it, okay? So as I continue to say, palliative care is not based on timeline, okay? Palliative care is irrespective of the clock. It doesn't have anything to do with death, okay? You don't have to be dying anytime soon to get palliative care. It's not based on how much time you have left, all right? What it is, it's for your needs. It's for your loved one's needs. It's for your family's needs. We're here to help figure out what you need to get through this journey, to get through, not only just get through it, but try to gracefully get through this journey with the least amount of suffering, physical, emotional, spiritual suffering as possible, okay? So the reason I really like to show this diagram is that palliative care can start at the beginning of your diagnosis, okay? So you can get it right at the start. And ideally, it's best to get it at the start, because as you remember that moment when you heard your diagnosis, your whole entire universe was flipped upside down, okay? And the suffering started at that moment. When at the end of that sentence, when you got that diagnosis, that's when it starts. And that's when you should really have somebody on your team who's going to be able to help you take this one step at a time, okay? Palliative care is here to help you when you're getting curative in treatment, when you're getting treatment that may be palliative, when you're getting, if you're just here for symptom management, we're here to help you with those things, okay? So the biggest thing from this slide is really understanding that you can get it at the start. You can get it at any time. Sometimes I tell patients and families, you can meet with us in the beginning, have a discussion, establish that connection, know that palliative care is there for you or your family whenever you want it, and then you don't have to keep following. It's not here to make you come to one more appointment, to get out of the house to come to one more appointment and have more discussions. It's something that I encourage you to connect with a palliative care provider, just establish that connection, see what it's about for yourself, see if you can really connect with that palliative care provider, and see how they can help. And I tell it, this is just kind of a rule of being human. Like, I want you to take what works for you from this presentation, and whatever doesn't work for you, leave it, okay? This is not here to push anything on anyone, but my hope is that you can take information from this presentation that works for you, and if it doesn't, just leave it. Just leave it. You have enough to deal with, okay? The point of this is to help give you information, to help give you knowledge, and knowledge is power, okay? So I again, and I'll say it again at the end, I just really appreciate that you're all brave enough to be here to talk about something that can be very scary. But with knowledge, with education, with information, we can kind of dissipate some of that fear for you, okay? So who gives palliative care? Okay, is it a doctor? Is it a nurse? One of my favorite parts about working in palliative care, and probably the main reason why I've stayed in palliative medicine for all of my career, is the interdisciplinary aspect of what I do, okay? We work very closely with social workers. We work closely with our nurses who are at the bedside. We work with chaplains who are truly the best at providing support for existential pain, for existential distress, okay? We have on my inpatient team here at Lenox Hill Hospital, we have a music therapist who is phenomenal. We have a massage therapist who is here to help with pain, who's here to help with nausea, just through relaxation. We have someone we call a holistic nurse, and she's someone who can provide things like Reiki. She works with a lot of oils that help people. I can't emphasize enough that palliative care is an interdisciplinary team. Okay, we work with all different areas of the healthcare system. It's not just a doctor, it's not just a nurse practitioner or a PA. And I think why I love this diagram the most is that who is at the center? Who is at the center? It's you. And I tell all of my patients this all the time, especially when they're in the hospital and they're terrified and they're scared and they feel so sick. They've got all these people coming in and talking to them. And then I come in to introduce myself and try to explore a little bit about what they understand. And they are just so overwhelmed with everything that's coming at them. And one of the first things that I try to say to them is empowering them to take control of the situation and really remember that they're in the center of all of this, okay? My line that I use a lot is that you are the captain of the ship, okay? Period. That's it. You're in charge. My role when I'm in the hospital here at the bedside is to help you navigate a hospitalization, okay? Providing information, like I said, knowledge is power. I'm here to help you get what information you need to navigate this hospitalization, and in the bigger scheme of their disease experience, just help them navigate treatment. So as it says just here, we're a multidisciplinary team, and we're here to provide an extra layer of support, okay? That's in the simplest ways. We're gonna talk a little bit more about symptom management in a second. But the second big bulk of what we do besides symptom management is helping to coordinate care. As you all know, maybe some of you have an oncologist and a radiation oncologist, and you're also seeing an endocrinologist, but you also have to have your heart failure doctor involved. That there's people who have serious illnesses often have other conditions that coincide with their disease. And there's a lot of people coming in and out, and it can be a lot. It can be a lot. So part of what palliative care can do is just kind of, again, you're the captain of the ship, is kind of help you figure out all the pieces, who's doing what, and help to coordinate the care among all the teams, okay? And really kind of coordinate, not just between palliative care and oncology, but really kind of coordinate communication between, say, oncology and heart failure, or oncology and physical therapy, or oncology and social work. Like, the point of palliative care is partly to kind of help with communication, because oftentimes a lot of distress that patients feel is from breakdowns in communication. Okay, so part of what I do is just making sure everybody's talking, everybody's on the same page, and we're all telling the same thing, the same plan to our patients, because that is what you need. You need things to be as simple and straightforward as possible, because you're on a roller coaster, and it's unsure and undetermined on when you're going to get off. So it's important that we make this experience for you that you're unfortunately going through as smooth as possible, as calm as possible, help to make it as graceful as possible. None of these things are easy, but part of palliative care's role is to kind of help with that. I would say really the meat of what I do, especially here in the hospital, and inpatient palliative care is a little bit different from outpatient palliative care, for reasons I don't really need to go into. The simple part is that in the hospital, people are sick. They're so sick they need to be admitted to in a hospital. Outpatient palliative care is actually is actually ideal. And the reason for that is because you follow with a palliative care provider for months, years. It's somebody that you see regularly. It's somebody that you check in with, who is there from the beginning of your diagnosis or at any point in your diagnosis and can help you get to where you are going, okay? Inpatient, I do a lot of symptom management, things like nausea, pain management. But the bulk of what I get when I'm in the outpatient world, when I'm seeing patients outpatient, is I'm managing pain, loss of appetite, and fatigue. And I always tell my patients, I need to know how you're feeling. I need to know if you're feeling depressed. I need to know if you're feeling anxious, because I need to know if you're feeling angry. I need to know how you're feeling, because I can take better care of you if I know how you're feeling. And it's important for me, and I encourage patients to feel what they need to feel. If they break down in the middle of a visit, they break down in the middle of the visit and we pause. Okay, because you're feeling a very heavy emotion and we need to pause there and we need to address whatever it is that's triggering that before we get into talking about XYZ, because at that time, you're not going to be able to truly grasp whatever it is the point of the conversation is if we're not taking care of how you're feeling in that moment, okay? Pain is really the big one, you know, and I don't want to get into too much detail, but there's lots of different ways to treat pain. It's not just opioids, okay? A lot of patients I see, they think that pain management means taking morphine, it means starting a morphine drip. There are many different medications that work on different receptors in your body to treat different kinds of pain. Pain is something that can be treated in a multimodal way. And what I mean by that is pain medication, but there's also things like massage therapy, there's Reiki, there are all these other ways to help treat your pain. You know, it's not just giving you medications to take to help you feel comfortable. Going back to kind of the anxiety a lot of people have about opioids, you know, part of palliative care is to help you process that and help demystify whatever preconceptions you have about opioids. Loss of appetite is a huge one. I see a lot of people, and most of my patients have all of these things, truthfully. And that's even more of a reason to see someone from palliative care, because you do have all of these symptoms and they all need different treatments. You know, I've been speaking to Stephanie in the last few weeks, you know, we've talked a lot about medical cannabis, which is something that many of my patients are on. And a lot of them feel, you know, nervous about bringing it up. A lot of people feel the taboo around it. And so part of palliative medicine is again, helping demystify these myths surrounding medical cannabis to provide you information, okay? Again, as I've been kind of talking a little bit about so far, pain is not physical. It's not just physical. It's emotional, it's existential. Part of our role in palliative medicine is to help figure out what kind of pain you're experiencing and treating that, okay? So there really is a holistic approach to palliative medicine. It incorporates multiple different disciplines, and more specifically with each symptom that we're treating, there's multiple ways to treat it, okay? So, you know, your oncologist is a brilliant person who is there to look at the genetics of your disease, to work with a radiation oncologist at the scans and see where things are, and kind of come up with what plan, what chemotherapy should we do? Should we do surgery first? Should we do surgery second? Should we do radiation and palliative? Should we do radiation and chemo, or should we do just radiation? You know, that's their sphere. That is their world. That is what they have trained in. Palliative medicine is really here to help with symptom management, okay? We are in the business of relieving your suffering, okay? We're not treating your cancer. You know, when I speak to other patients, we're not treating your heart failure. I'm not here to help cure Parkinson's disease. What I'm here to do is I'm helping to relieve your suffering as you go through this disease experience, okay? Is it pain? Is it depression? Is it appetite? I want to help relieve your suffering. So that's really that's really mostly how patients come to see me first, is for symptoms. As I've talked a little bit about earlier, we don't just do symptoms. We help to coordinate care. We help to bring all of the people to the table to make sure everyone's saying the same thing to you, to make sure everybody's on the same page, so that we can minimize stress for you. Because there's nothing more stressful than some provider coming in telling you one thing, and then 4 seconds later, another provider from a different department coming in and telling you something that is completely different from what you just heard. So part of palliative care is really trying to coordinate all those discussions. Here in the hospital and outpatient, it's really wonderful to build a relationship with you and your families, especially outpatient. Outpatient palliative care, I cannot make enough plugs for that, because the beauty of outpatient palliative care is you're following them for a long time. Here in the hospital, I see people for a few days while they're here admitted, and then they go home. So I'm able to build that relationship in a very acute setting, but there's a real special beauty about doing outpatient palliative care and really getting to see our patients go through their experience and build that relationship with them, build that trust. We talk about what your goals are, all right, we're talking about chemotherapy, you're unsure if you want to do it or not. We talk about, what's a good day for you? What is it that makes your day worthwhile? Is it, some people say, it's extremely important for me to have as much energy as I can to spend time with my grandchildren when they come over on Saturdays. Some people say, it's extremely important for me to be able to be in the kitchen, to be cooking, to be working with my hands, to be smelling the food. The cooking is a huge part of my life. I need to be able to do that for as long as possible. We help you have a reason to do the treatment. And it's not just because I have a disease and I want to cure it. We want you to be more specific about that, okay? We also do help with things like housekeeping, like making sure you have a healthcare proxy, okay? So for those of you who do not know who a healthcare proxy is, it's a physical form that basically, and it depends on each state, I designate XYZ to make decisions for me. God forbid I can't communicate what my wishes are. So we help you get all of these things in line, all right? And as I talked about a little bit, we're here to kind of check in to see how you're doing with everything, okay? How are you feeling with all of this? Is there something that we could be doing better? Could we be doing a better job treating your anxiety? Could we be doing a better job supporting your husband or wife get through this? Because sometimes I have patients who are like, I'm doing okay. The pain is better. My appetite is improved. My husband is having a meltdown and I can't handle it. We're here to help with that, okay? Palliative care understands that you're not the only one going through this, that everybody else in your universe is also going through this in their own unique way. And a lot of times cancer patients I take care of, they're like, I cannot be more thankful for all the love and support that I have from my neighborhood, from my coworkers, from my family, but I cannot answer one more text message of somebody asking me how I'm doing. And I feel terrible telling them I don't want to talk about it. So we help you with that. And oftentimes I say, listen, what you need to do is you need to pick somebody, you need to pick a point person, whether that's your best friend, Sally, whether that's your husband, whether that's, your nephew or niece, whomever. That is going to be, you need to delegate as that person is your communicator. Okay. So palliative care really kind of follows your lead on what is it that's causing you suffering as you go through this. Okay. What is it? We break it down and then we figure out what it is that you need. I really love this painting because to me, all I can see is life. It's about, when I look at it, it's loud, there's music, there's dancing, there's so much life going on in this painting. And I think it's really important to kind of tie that with palliative care, because as I said from the start about this, palliative care is not about dying. It's about living. Palliative care is about living. It's about helping you live the best life that you possibly can with the least amount of suffering as you deal with this illness. That is what it is. It's about living, okay? There's ample studies actually, and one of them is coming out of Boston at MGH that shows that if you get palliative care, it improves your quality of life. It improves your symptoms. It makes that, even more importantly, you know, sometimes just navigating the labyrinth that is our modern healthcare system, we can help you navigate all of that. Okay, so we're here to kind of help you navigate and help make you feel better. Here we go. Just move this right over here. As I kind of mentioned in the previous slide, you know, there is ample data that shows that people feel more comfortable, people suffer less, but also that they actually often live longer. Okay, there's a lot of interesting data that suggests that not only does palliative care not hasten death, it actually helps you live longer. Okay, and I think that's a really, really important thing to pause there. I'm going to be on, you know, I can't promise you or guarantee that if you receive palliative care, you will live longer, but I mean, it makes sense, right? You know, if you are supported, if your needs are addressed, if you have somebody who can walk with you through this labyrinth of a modern healthcare system, who can carry you through these ups and downs, walk with you, through these ups and downs of going through treatment, you know, it makes sense that you're going to live longer because you have somebody helping you to suffer less, okay? I think just to back this up even a little bit more is that the American Society of Clinical Oncology actually has a guideline, okay? And it truly recommends that patients who have cancer are receiving palliative care early and at the same time as they're getting their treatment, okay? And it's inpatient or it's outpatient. And I hope that this slide you can take this slide with you, because I want you to know that it's available to you at any time, okay? There's no timeline. If you're unsure, we'll talk about what to do and how you can get more information if you feel like you don't know if it's right for you. And we will do that on the next slide. Okay, so how the heck do you know if it's right for you? You know, here's this presentation, I'm giving you all this information, you know, maybe some things are resonating with you. These are questions that if you answer yes, it's probably right for you, okay? Do you have a serious illness? Do you have symptoms that prevent you from living the life that you want, from being as active as you want? Are you frequently in the emergency room for nausea? Are you frequently being admitted for pain management? Are you scared or confused about knowing what's coming? Are you overwhelmed with all of these options that are being thrown at you? Surgical oncology, radiation oncology, chemotherapy, immunotherapy, targeted therapy. You know, I can't keep track of all of you. You know, part of what I do is I help you put all the puzzle pieces on the table. Take a minute to pause, put all the puzzle pieces on the table, and help you take step by step, what is it if I do this puzzle piece? Or what if I do this one with this one? We help you talk about the trajectory of whichever treatment you want, okay? We wanna help match your treatment with what your goals are, okay? Some people, you know, some people, they get to a point, and everybody's experience is different. Everyone's experience is unique. Every person is unique. You know, some people are like, you know, if I truly can't, you know, be at the table comfortably with my family when they come over, you know, I'm not able to do that anymore. And I'm really depressed about it. And really what's most important for me is that I don't maybe want to do this chemotherapy. I only want to do radiation, because if I do the chemotherapy, I'm going to have symptoms that may limit my ability to sit at the dining room table with my family. So we help advocate for you to advocate for yourself, you know, with your oncologist. Say, you know, listen, this is why I don't want to do chemotherapy. I just want to do surgery and radiation. Okay. It's important for me to be able to sit at the table with my family, and I want to make sure that whatever I agree to do for my cancer is going to allow me to do that as comfortably and for as long as possible. And then last but not least, you know, I talk a lot about the patients, but how's your family doing? How is your son? How is your daughter? How is your neighbor? How is everybody dealing with this? Okay, what do you need to help them? What can I do to help them? Okay, what do they need information? Do they need to be explaining things? You know, sometimes I have patients who are just like, I'm exhausted. I want to take a break from chemotherapy right now so that I can just kind of be at home with my loved one. So I can just go on this cruise to Alaska that I wanted to go on my entire life. But I can't tell my loved one this because they want me to keep fighting, and they are making me feel like if I don't do this chemotherapy, that I'm giving up, and that, you know, and then that's not helpful for you. You know, guilt and shame, that you don't, no one needs that. And you especially, who has a serious illness, you definitely don't need that. Okay. So part of Palliative's role is to make sure that everybody in your universe is kind of on your page and the same page as you as best as we can make them. You know, if you need help being able to tell someone you want to take a break from treatment, or if you need help telling somebody you need, you know, you want to get involved with palliative care. Some people are like, you know, loved ones will be like, palliative care, like, we don't need that. That's dying. That's hospice. Like, you don't need that. I don't want you to be thinking about those things. We don't need that. But meanwhile, here you are, hopefully after this presentation, being like, you know what? I think I want to meet with somebody. I want to see what they have to say, you know, and maybe you need somebody to kind of help demystify all the myths that surround palliative care. Maybe your loved one needs education. So really, like, any of these questions here, if you answer yes, it would be probably beneficial for you to try to find someone in palliative medicine just to connect with. And again, see how you like it. If it doesn't fit for you, if it's not a good connection, if it's an issue with the provider, maybe we need to get you a new provider. If you feel like it's not the right setting for you, that's fine, you know, but it's there for you if you need it, and you're eligible for it. You're eligible for it. Okay, so we've talked a lot about a lot. We've talked a lot. We've talked a lot about what palliative care is not. It is not hospice. It is not end-of-life care. It is not taking away hope. We've talked about what it is. You know, we're here to help you relieve your suffering, whether that's physical, existential, spiritual. We're here to help you coordinate all of the people that are involved in your care. We're here to help communicate, whether that's with loved ones. We're here to help communicate information to you. We're here to help you with these things. We talked a little bit about how you know if you're ready for it. So say you answered yes, and you're like, okay, I wanna get palliative care. You gotta ask for it. The first step is to talk to your doctor. Usually, talk to your oncologist. I mean, I am a provider. I can also say, if you want to just forget the provider, go to your social worker. Go talk to your nurse. You know, nurses and social workers are people that don't have white coats, and they may be somebody that you connect with more deeply than your oncologist. That happens sometimes, and that's okay. That's okay. Maybe they're the person that you ask for. You know, I usually stay in the outpatient world, talk to your doctor and see what they can do. If not, talk to your social worker or a nurse. This website here at the bottom, pretty simple, getpalliativecare.org. I'll provide that link in the chat when we finish up. When all else fails, you can go to that website. They have a handout. It's like right at the top. So it's not like a web of links and tabs. It's right there. You go to the website, it says handout for patients and families. And right underneath it, it says, how can I find a provider? Okay, so if all else fails, this is a great starting website for you. As far as where you can get it, inpatient, outpatient, I would say if you're coming into the hospital with pain or nausea, I would just kind of ask to speak to someone from palliative care. You're obviously in the hospital because you feel terrible and you're suffering. So instead of kind of waiting to see what the primary medical team is going to do, it may be worthwhile to just be, listen, do you have a palliative care team here in the hospital? I really want them to take a look at my scans, to take a look at my medications, and to see if I can change to a different nausea medication. I need them to take a look at everything and say if I need to add a pain medicine or what do I need? But you can get it in the home or in the hospital. And of course, you know, it's covered by most insurance plans, including, you know, Medicaid and Medicare. Unfortunately, we're still in kind of this moment in history where you do have to ask for these things. Sometimes in bigger cities where there's a lot more hospitals and their services are a little bit more robust just because of the nature of living in a city, it's usually a little bit easier to get palliative care. You know, if you're living in a rural place, I admit it's difficult. And there are people in palliative medicine who are just specializing right now in trying to see how they can get these services to people who don't live in major cities. That is why, for those of you that maybe don't live in a major city, this website here at the bottom is extremely helpful, because that you can do on your own time. You can go to the website, find local providers for you. And also it's a modern website. There's a whole other slew of other things that you can get from the website. But like the two main things I want you to take away is that from the start, when you go to that website, you can find a handout for patients and families, and you can get information on where you can find a provider that's close to you. So I really want to thank you for being brave and being here. And I hope that this was a discussion that at least clarified that palliative care is not end of life. It's not hospice. It has nothing to do with how much time you have left. It's hard to talk about hard things. And I appreciate that you're all here tonight to kind of listen to this. And I hope that you can take this information and what you've learned and continue to talk to other people who are going through similar illness experiences as you are, because, you know, we're in the middle of a cultural shift and things are shifting quickly. You know, the fact that the American Society for Cancer is recommending palliative care from the start of diagnosis is huge. But as a culture, we still have a lot of work to do. So I appreciate that you can be here and kind of get this information and hopefully kind of continue to demystify what palliative care is, because it's hard to be human. You know, human being alive is suffering. And you add a cancer diagnosis on top of that, on top of being a mom, on top of working, on top of living through a pandemic, you add all of those things and it's a lot. It's a lot. So if you can ask for somebody that can kind of help you navigate everything, I do think that you will feel better by it. I don't want to sound cliche, but I do have to say that I have never in my experience met a family member that said that they regretted getting us involved sooner. You know, actually, conversely, usually what they say is, why didn't I have you sooner? Why weren't you here sooner? So I hope that can be helpful information for you. So I just want to kind of open up this time to kind of get any questions or comments that you have. I do have to say, you might have to speak very loudly and kind of slow-ish, just because I'm having a little bit of delay on hearing on my speaker on my end. So again, thank you so much for having me. Thank you, Stephanie. And most of all, just thank you to all of you for being here. It means a lot to me. Thank you.
Well, Charlotte, this presentation was extremely comprehensive and very helpful, I think, to a lot of people. You validated a lot of feelings that many of the people on this call have gone through and are going through currently. And I think it was excellent. And I would like to say that you answered one of the first questions about our palliative care offered at all facilities. And you definitely answered that by, as it is a newer type of supportive care that's there, that it's nuanced and that it's growing. The field is growing.
Yeah.
And one question that I would like to ask that somebody emailed to me, is there specific criteria when somebody's looking for a palliative care specialist? Are there certain credentials, or could they find that looking on that website that you shared with everybody?
Do you mean like credentials as far as like board certification?
Yes. Is there something that somebody should be looking for a palliative care specialist or a team member?
Got it. So as far as physicians goes, so the MDs, the DOs, oftentimes they're board certified, and all physicians are board certified in whatever specialty they are. So people can be board certified in primary care. They can be board certified in intensive care. For physicians who work in palliative care, they're usually board certified in palliative medicine. People like me, I'm a nurse practitioner. I also work with physician's assistants as well. Ours, it's a little bit different. So for me, I did a fellowship. So I did an extra year of training in addition to my education, my nursing education, that was just focused specifically on palliative medicine. This is not necessary for NPs to have in order to work in this field. Oftentimes, it's people who have been working in, I'll use cancer for an example. They've been working in oncology, and they've really become really drawn to the palliative world. And now they want to work specifically in symptom management. So as far as like NPs and PAs, not so much. But as far as physicians go, there's board certification in either hospice and palliative medicine. And again, I'm using the H word. I am saying hospice because I'm not going to lie, as I said in the beginning, hospice is a part of palliative medicine. So oftentimes physicians who become board certified and want to work only in palliative medicine, they also are usually double boarded in hospice as well. Does that answer the question?
Yes, absolutely. So thank you for clarifying that. The next question that we received is, will palliative care see you if you're not in severe physical pain?
If you're not in what?
In severe physical pain.
Yes. I can't scream it from the mountaintops. Even if you're unsure, say you go to this website, you do the little simple quiz, like, is palliative care right for me? Yes, no, answer all the questions. You just living with a serious illness are eligible to meet with somebody from palliative care. That's it. You can be at any stage. You can be at any point of your treatment. You are eligible to meet with somebody from palliative care. And again, maybe you meet with them once and you don't have any pain. Your appetite's pretty good. Your energy's great. You go to a therapist, you have a psychiatrist that you meet with regularly. You feel very supported by your church or your spiritual community. But, maybe you're interested in just seeing what it's about, and you have a meeting, you have an appointment, you meet with them, and then maybe you don't see them for a few months or a year, but just knowing that they're in the background, that they're there for you if you need them, can be helpful. So I think yes. Like, I think if you have a serious illness, period, you can see somebody from palliative care.
Okay, thank you for clarifying that. Next question that is posed is, will a palliative care physician prescribe antidepressants, or will they refer you to a psychiatrist?
That's a great question. And like I said in the beginning of our chat here, is that I talk about pain and physical pain and abdominal pain and constipation, but your pain is emotional. There's a lot of it. And I'm here to help treat that. So yes, I do have patients on antidepressants. I do have patients who have medication for anxiety. For those people who feel uncomfortable about being on an antidepressant, I'm not going to force you to be on it, but I can be here to talk to you about why it might help you. I can be here to help maybe take away that stigma of being on an antidepressant while you go through cancer treatment. I mean, I'm here to help you understand what tools you have in your toolbox. And it's up to you to decide what tools you want to use. And I will help you make that decision. But absolutely, absolutely. If you are feeling depressed, anxious, I do have patients on that. And sometimes my patients are relieved that we're talking about mood, that we're talking about how you feel, because a lot of, visits with their oncologist, it's really focused, the short time that they have. Unfortunately, we live in this ridiculous healthcare system where we have to see patients under a certain period of time. But, the bulk of that visit is talking about treatment, next infusion, next lab draw. We're going to do a scan then. We're going to do a scan then. But meanwhile, you want all this information, but you're just like, I'm also vomiting all the time and I can't sleep. So these are things that palliative care can really just kind of know what's going on in oncology in the background, but really get to the root of treating your suffering, which is, in the sentence I just used, your nausea. As I talked about a minute ago, your depression. So these are things that we really can help with. And yes, I'm really glad that you bring up antidepressants, because mood and how you feel as you go through all of your treatments and afterwards is important.
Thank you very much for sharing that. And what I loved about what you focused on also this evening is reiterating the importance of patients being able to advocate for themselves. Yeah. If somebody happens to be at a facility and their current doctor does not think that palliative care is necessary, what would be your recommendation? Should they speak to the social worker then, or the nurse practitioner that might be on the team, and just to get another voice into the conversation?
I love that question. You're asking all like the most important questions. Like I said a few minutes ago, you are the captain of this operation, period. That is it. This is your body. This is your disease. And you should be in charge of what services you get and what services you don't. So I'm not trying to encourage confrontation, obviously, with your provider, but it truly is your decision. And if your oncologist is saying no, then maybe think about who else in your treatment team can help you advocate. Is there a social worker that you feel strongly connected with? Is there a specific infusion nurse that you see every week that you really trust? I go to those two because I feel like I work a lot with nurses and social workers in the hospital and in the outpatient world. Go to them and help them help you advocate for what you need. Okay, because you did not go to, maybe some of you did, but like you've never had cancer, you've never gone through this before, so talking to an oncologist about what you want and what you don't want, hasn't always been your wheelhouse. Okay, so maybe you need to connect with someone in your treatment team, a social worker or a nurse, who you can say, listen, I'm kind of interested in just talking to someone from palliative care. Can you help me? What can I do? And they would be the person that can kind of help take your next step, or communicate with the oncologist or a certain provider to say, listen, you know, he or she is talking to me about this, and this is why they're talking to me about this. And what they really want is they want to talk to a palliative care provider because they have a lot of pain, or they're feeling really sad, or their husband is really overwhelming and causing her a lot of distress at home. Sometimes it just kind of takes finding that person on your treatment team that can be your advocate. And when all else fails, the website, which we'll share in the chat in a minute, getpalliativecare.org, you can do it on your own. You know, you can go to the website, see what palliative care providers are there. You are the captain of the ship, okay? This is your treatment, this is your disease, this is your journey. If there's something that you want to learn more about, if there's a service that you're curious about incorporating into your treatment plan, I need to advocate for you to advocate for yourself. So when all else fails, ask a nurse. I am biased because I'm a nurse practitioner, but you know, ask a nurse. They'll help you.